Llewellyn, thank you so much for joining us once again on Eureka. We're talking about pharmaceutical patents today. Now, I know there's a few ethical issues surrounding these protection patents. What is the main issue here?
Well, I think the main issue comes down to a patent effectively gives a pharmaceutical manufacturer the right to stop other people using it.
Right.
So in other words, what I can do is almost dictate the price at which this is going to be sold. The counter to that is, well then, aren't you really making sort of money out of human suffering? In other words, what value is a human life? Where people are dying, particularly in Africa, and particularly in South Africa, where you're looking at HIV and the antiretrovirals.
Right, right.
That's the one aspect. The counter to that, of course, is that if you look at the drug manufacturers, what you're doing with patents, you're relying on innovation. So you need the innovators. And for pharmaceuticals, it's very rare that you can actually get one person developing these drugs. So you need teams, you need laboratory facilities, you need lots of money. Once that's been done and you've obtained a patent for it, the difficult part starts, and that's obtaining registration so that you can distribute it. You don't want another thalidomide scenario. You're trying to avoid that at all costs.
Give us the scenario for our viewers' sake.
Well, the thalidomide was where a drug was approved. It was a painkiller. It was indicated for use with pregnant women.
Right.
And it was used. And then they found out that it actually restricted growth of the long bones. In other words, the long bones in the arms and the legs. And it was an absolute disaster. And it affected, by the time that it had been discovered, remember that you're looking at 9 months at least. So, absolute disaster.
Just spiraled out of control.
That's right.
Gosh.
So
let's get back to the approval process, Llewellyn. That's quite a challenge, isn't it?
Well, that's why. It's because you don't want that. The regulatory agencies must protect the people. So they make sure that insofar as they can, that won't happen again. And to do that will take you somewhere between 7 and 12 years.
And your patent's only valid for 20?
20 years. So in other words, let's say it's 10 years that the approval process takes. In other words, what you've got now, instead of this 20-year process or time period, you now have 10 years.
Right.
So what you need to do is recoup all your research and development, marketing, and everything that goes
within those 10 years.
Within those 10 years.
Because surely the research, just alone, is an astronomical cost.
It is. You know, I've visited some of these laboratories where you can look at laboratories which are closed down, essentially because they're waiting for the next project. And there's equipment there that I'd only ever read about in books. You know, you sort of vaguely hear about this fancy state-of-the-art stuff. So that has to be done. And also, in the approval process, you're looking at 1 to 2% of the drugs submitted, or the drugs that, where a pharmaceutical company starts, of those 100% of the drugs, only about 2% will go through and actually be registered, if that.
Wow.
So in other words, all of the rest of that is effectively wasted. Unless you can use it for some other reason. In other words, you'll get the use for X, Y, and Z is not indicated.
Right.
So there's your problem.
So Llewellyn, after the 10 years, let's say now it's on the shelves, it's been distributed, your product. After the 10 years, when the patent lapses, what happens then?
Then it's open to the public to do what they like with. You cannot infringe the patent because the patent no longer exists. And that's when your generics come into the market.
Right, okay. So the generics have to wait until the patent has lapsed? Until
there's no more protection. Look, if a pharmaceutical company does apply for a patent which is not valid, in other words, it's not inventive or it's not new, then its validity can be attacked, and then you can actually, then the time period's a lot shorter. So then your generics come into the market, and because you're looking at there's no research and development, they can piggyback on the registration. The key to a generic is it's exactly the same as the patented product. So there's no need for me to do all those tests. So I don't have to do that 10-year scenario. Then I can reduce the costs. And then, of course, the patent holder is forced, in many cases, to follow suit. So that's the benefit of the generics. But without, this is my belief, I believe that without the monopoly, without that benefit, what you would get is a lot more companies saying, well, look, then I'm not going to innovate. Remember, too, the pharmaceutical companies have their investors, their shareholders also to take into account. Another problem, which I also find quite interesting, is that of what value is a human life? And yet, the most successful pharmaceutical inventions are not aimed at saving human lives. The most successful pharmaceutical invention to date, I think, is a Pfizer product called Lipitor, which is anti-cholesterol.
It's a lifestyle product.
It's a lifestyle drug. It's not a life-preserving product. Your life-preserving products, the most important ones right now in South Africa, are your antiretrovirals. And I'm not, I think, well, I don't think, I know that what you'll find is that a lot of the pharmaceutical companies are making very reduced profits on those products.
Which is a good thing, right? That's the way it should be.
It's almost like I'm going to say it's like a social conscience, but I can't think for them. Effectively, what they've done is they're coming in at fairly baseline prices.
Right. Llewellyn, thank you so much for chatting to us on pharmaceutical patents. Thank you.
Pleasure.